Greetings, ladies and gentlemen. My name is Yudhistira Pradnyan Kloping. I'm a medical doctor and a urology resident from Airlangga University. On behalf of my colleagues and co authors, I am here to ask an important question regarding the medical education system for undergraduate students amidst the pandemic. Are online based clinical rotations for medical students sufficient? In March 2020, the World Health Organization declared COVID 19 as a pandemic or outbreak. This led the Indonesian government to recommend policies limiting community mobility and social interactions as part of the physical distancing movement to help contain the spread of the virus. Many sectors in our country were affected. Our medical education system is also affected, particularly during the clinical rotation phase for undergraduate students. Before the pandemic, during the clinical rotation phase, usually students are allowed to practice what they have learned in their preclinical phase with direct real life patients so that they can have face to face interactions performing history taking, physical examination under supervision, of course, by senior doctors and teaching staff. However, due to the pandemic, we have moved from this to this. Of course, this is different when we compare to how they learned during their clinical rotations before the pandemic. However, a systematic review in 2019 actually suggested the possibility of online learning for undergraduate medical students. The current transition to online system in many medical faculties in the world were made with haste because of the sudden occurrence of the pandemic. A lot of them were unprepared because of the sudden nature of the pandemic. And thus, the role of online learning for medical students is still unclear, in particular, the clinical rotation phase. In this study, we aim to evaluate the online clinical rotation sessions during the pandemic descriptively, and we also analyze key issues regarding both the challenges and also the benefits of online based clinical rotations. We asked the medical students and teaching staff members regarding the implementation of online clinical rotations during the pandemic, whether the competencies of a medical doctor achieved, and were there any suggestions for improvements. So the participants in this study included all undergraduate medical students in Airlangga University that they were just entering clinical rotations. We observed the recorded learning sessions by 3 observers, and the lecturers were instructed to evaluate the learning sessions based on the technical aspects, classroom management, the discussion quality, as well as student involvement during a discussion. And the evaluation was made based on a Likert score. We give the lecturers and students a set of questions, but the questions are all open-ended questions that focus mainly on experiences of online learnings, whether there were any difficulties that were perceived, and also conveniences about the satisfaction level of both the students and teaching staff, whether they achieved the competencies that were expected of them, and whether there were any suggestions for improvement. There are several online clinical sessions that we were able to record. The start time usually starts in the morning. However, there are several clinical sessions that start later in the afternoon, and this would cause a problem early on. And the duration ranged from 30 minutes to even 3 hours for certain sessions, especially in sessions where the students were expected to be divided into groups and each of them presented a case of their own. Some cognitive aspects can be achieved, but practical skills still require offline learning, and suggestions for improvements were given, in which some students and teaching staff members suggested that the learning infrastructure for online based clinical rotations should be increased. From the in depth interviews, we've discovered some interesting input from both the teaching staff members and the students, in which both groups agreed that the time and place flexibility is much better compared to the offline learning phase. However, this flexibility could become a burden because some schedules could become irregular, later in the afternoon, or even in the evening for some sessions. Online learning is considered capable to transfer basic cognitive aspects. Unfortunately, it is not sufficient to integrate theory with practice. It's just how to think like a clinician or getting the whole picture of the complexity of real life patients, because real life patients are indeed different from simulated patients. The most critical discrepancies were related to clinical skills training. And some students actually had several attitude problems in which they did not obey the teachers to turn on their cameras or not prepare study materials enough. And students claim that they lost opportunities to interact with patients' family, or other healthcare practitioners. This result in them feeling that they have lost a staff or resident role models, which they usually supposedly they had in the actual offline clinical rotation. Suggestions were made regarding combining both online and offline learning, and several staff argued actually that even though we are conducting a study during the pandemic, this is a professional risk as a doctor that could not be avoided. Therefore, they should be trained and prepared instead of instead of making them avoid offline classes or avoid patients. In the future, the learning system could evolve into Zoom learning, which is more simplified because Zoom is universally and generally used as a virtual platform in many medical faculties. And the pandemic is actually a significant momentum for e-learning development. However, we could not deny that the complexity of clinical exposure could not simply be replaced by offline online platforms, and educators must identify the important aspects what should be prioritized in the future for a combined strategy that should always be based on the safety of students, teachers, and patients, especially during the pandemic. Thank you.